Professor Renwick, thank you very much for joining us. Just very briefly, could you outline what gives you the authority to talk on this subject?
Yes, I've just recently retired from the University of Southampton, where I was a professor in the School of Medicine. And during my career, I've had over 40 years of active research interest on intense sweeteners, or low-calorie sweeteners, as they're also called.
One of the biggest problems facing the developed and developing world is obesity. Can sweeteners play any part in reducing the problem of obesity?
Well, the simple answer is yes, because intense sweeteners, low-calorie sweeteners, can replace sugar as components in a diet or in a food. If they could replace sugar, then you're removing a significant source of calories and replacing it with no calories at all. So if you consume that meal, you'll be consuming fewer calories. And that has important health consequences because overweight and obesity has been clearly shown to be linked with a number of diseases: cardiovascular disease, arthritis, diabetes, nephropathy, renal problems, as well as some types of cancer, particularly breast cancer and prostate cancer. They're really important and very significant health risks of overweight and obesity. And intense sweeteners help us to control our body weight as part of a sensible diet combined with exercise.
You touched on diabetes. Is there any direct influence or effect on that condition that sweeteners can have?
It used to be thought that sugar could not be consumed by diabetics. It's now realised that small amounts of sugar are of no problem at all for diabetics. They can cope with it. But it's the same issue, because if you have many diabetics, especially type 2 diabetics, are overweight, and if they reduce their body weight by controlling their diet with the use of intense sweeteners, then they can reduce their risk of the disease progressing, and for overweight people they can reduce the risk of the disease. So yes, there is a very significant link between controlling your body weight and diabetes, not necessarily between controlling your blood sugar and diabetes. Sugar and intense sweeteners don't affect blood sugar that much, but it really is the obesity issue again, the weight problem, which is the key to controlling diabetes.
Staying on the subject of people's health, what about dental hygiene? Does the use of sweeteners have any impact on the state of people's teeth?
Well, it does, yes, because sugar is a fermentable material, and the bacteria in the mouth can ferment and break down the sugar to produce acid, which then dissolves the dentine of the teeth. Now, intense sweeteners can't do that. The bacteria can't metabolize the intense sweeteners to produce acid, so they do not produce that problem in the first place. But I think even more important, intense sweeteners are an important ingredient in fluoride-containing toothpaste and fluoride-containing mouthwashes. And without intense sweeteners, you wouldn't be able to have fluoride toothpaste, and everybody would have the terrible teeth and fillings that I've got at the back of my mouth, because I was born at a time when fluoride toothpaste was not readily available, and I used to eat lots and lots of sweets.
So without the sweeteners, toothpaste would be unpalatable?
Fluoride toothpaste would be unpalatable, yes, absolutely.
We've heard a lot about the benefits of sweeteners. It sounds like a wonder product. Is there anything that is on the negative side of sweeteners? Is there anything we should be worried about?
There isn't, because sweeteners, like all other food additives, are highly regulated and controlled. And the amounts that are permitted to be added to food are under control by the regulatory authorities. All intense sweeteners have to undergo a very thorough safety evaluation, and the results of those safety studies are then assessed by national committees like in the UK. The European Food Safety Authority looks at all the studies, and the World Health Organization committees look at the studies. And the basis of those, then sweeteners are or are not approved. So all the approved sweeteners have been very thoroughly tested. And the levels that are permitted are such that they will not produce adverse effects in humans. So yes, they are. It really is all benefits, despite what you can see sometimes if you do a Google search on the web.
And of course, sweeteners have been around for a while. This is not something new, some newfangled product.
Well, no, indeed. Sugar's only been around for 500 years. And of course, that has associated with very many health risks at the amount we consume, whereas in contrast, the intense sweeteners have been around for about 120 years for saccharin, around 60 years for cyclamate, and 30 to 40 years for aspartame. There are recent other ones coming along all the time, but they're not allowed to be added to food until they have been thoroughly evaluated.
Professor, thank you very much.
My pleasure.